Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I am here today on a Saturday morning with my uncoffeed, uncaffeinated co-host, Dr. Millicent Rovelo.
You are outing me. I am struggling. It is Saturday, and it's been a long week, and we haven't gotten around to doing our podcast this week. So,
Well, there's a lot of reasons.
there's a lot of reasons. And you're here operating. I have a pile of charts to go through. So it's like, well, let's just do this on Saturday
you have
morning.
to go over to Santa Monica too, don't you?
Maybe. Yeah.
Maybe.
Yeah, maybe.
So anyway, here we are.
Here we are doing our
And-
podcast.
And I had an interesting, back from vacation, which was why we haven't been able to get into the studio,
Yes.
but we'll be there on Wednesday.
Yeah, someone took a European style month vacation. I'm just going to take the month of August off.
That was, it was good. I'm glad I did.
Yes.
It actually was a good recharger. Got to spend time with the family, the kids, the wife, the whole shooting match. It was really cool. Saw a friend of mine, Henning, Gregory, who's a plastic surgeon in Berlin. And he was here many years ago when he was a fellow with Wolfgang Gubisch from Stuttgart. And back in the day, he was the one who taught me about Kartoffelnase.
Ah, Kartoffelnase.
Yes, he was the one who tells me that after they called it the potato nose, which is the Kartoffelnase.
That is definitely a thing. I am very familiar with the Kartoffelnase.
I know. Well, that happens with revision rhino, but that's not what we're talking about today.
No.
So today we're talking about rating sites and how to use them, because I had an interesting experience where now this Newsweek thing came out, which was a big deal. And
That's a big deal. That's for real.
I think everybody on that Newsweek list feels like it was a good way to kind of figure out who the top plastic surgeons are according to other plastic surgeons.
Right.
We don't have a rating system on, like, I don't finish a rhinoplasty and there are 3 judges in the corner that hold up, scorecards like, 10, 9.5. Like, it isn't that way.
Right.
And you can't have that in medicine, right? But you can have statistics and you can have regular sort of what the outcomes are. And so that's how your peers know what you do. And so that's kind of where I think that's why that Newsweek poll was sort of important. But I had an experience where I was called by WebMD.
WebMD.
Which is a big site.
Oh, yeah. People definitely use it to get their medical information.
Right. And so this is not to disparage WebMD or to say that anything that they're doing is not right or not good. They're doing something super cool. It's a great website, has a lot of information. I recommend it, quite honestly, to get information. They have huge articles written by very smart people. But the call was to tell me that they are making a network of preferred providers that they, and by the way, I hate that term.
I can't.
Because I'm not a provider. I'm a doctor. I'm a surgeon. I'm not here to provide for you. Like, you pay me, I'll operate. I'm a surgeon.
We're very transactional.
Yeah, this is not like, I'm not a provider. So that term has been inserted into the vernacular of the English language in order to reduce the status of physicians and surgeons.
Oh, yeah, because everyone's a provider.
Right.
Mid-levels, NPs, PAs.
Right.
In order to just lump us all into one group, we are all known as providers, because it's just easier if we're like kind of all the same.
Yeah, well, this provider did 4 years of medical school, a 7-year residency, and over 5,000 rhinoplasties, over 1,000 facelifts, and so I have provider sort of like doesn't bring it home for me in what it is that I do here in this Roxbury Clinic and Surgery Center.
That's why you were a preferred provider.
Well, that's good. Thank you so much. But I'm not preferred. You know why I'm not preferred?
Why are you not preferred?
Because they needed a 45-minute discussion in front of a computer so they could show me the value of being one of their preferred providers.
How can they help you?
Right. Well, of course, and so of course it's a big pitch for me to pay some money to be on their site.
It's always about money.
Right. It's always about, well, all you have to do is pay $10,000 a month and you can be a preferred provider. So from my standpoint, I don't know what it costs. That's just me making it up. But the thing is that there are so many of these, quote unquote networks that are based on nothing more than will you write us a check?
1,000%. Yes. When we get phone calls from them every day. I mean, sometimes the girls, I feel bad in the front, are constantly fielding things. And they'll come back and they'll be like, I have Shelby from Real Self on the phone. And she says, it's important that you speak to her right now because you need to get your account in order. I'm like, it's not an emergency.
Really not.
It's not an emergency. Shelby from Real Self can chill.
Yeah.
But they come back, they're in a rush, and they freak out my front desk people because they make it sound like there's some emergency, and they're like, I'll hold for the doctor. And Jessica's like, she's kind of in surgery.
Yeah, it's like, your marketing plans aren't exactly part of the operation she's doing right now.
They're very aggressive, and the rating sites certainly will come after you in a big way to take your money. I mean, everyone is out to take money.
Yeah.
Like it's in a really crazy way. I had one, it was a local news channel, a local cable channel, and they wanted to highlight like top doctors or top businesses in your community. If you pay us this amount of money, then we'll make a little promo video for you and highlight you. And all that's fine. I mean, these are great ways to get yourself out there. I mean, but you have to understand as a consumer that when you see these things, they are marketing pieces.
Yes.
They are paid for, and we are paying for them to get our name out there in front of people. And that's what it is. It's marketing.
And no big deal.
And
you should.
No big
we
deal.
all do.
We all market in some way or another.
Otherwise, people aren't going to know you're there.
Exactly.
It's the old days of word of mouth referrals have sort of gone to the wayside. It is all about who's on Instagram, who's on TikTok, who's pushing the ads through Facebook. Who's we had a billboard, which was awesome.
We had a billboard, so there's that.
Billboard's coming back. Don't worry, we're going again because I really liked the billboards.
I liked the billboards.
Yeah, they were cool. And by the way, like people, I don't think a single patient came in who saw the billboard says I'm going to go to them, but our podcast numbers did go up. So it did bring awareness to the podcast, which was big. And it was confirmatory for patients who's like, and I just left your office and I was driving back to my side of town and boom, there's your billboard, which is cool. And so getting awareness for the podcast was good because we don't have like big advertisers. We honestly just don't have an agent and we don't have time to do it. And that's just not our thing.
That's why we're doing it on a Saturday morning before cases start.
I know. I have to go in there and fix this nose up right away. But here's the thing. That WebMD phone call is interesting because here I am as a guy that was voted to be one of the top surgeons for facelifts, for rhinoplasty, eyelid surgery, whatever. My peers believe that I'm one of the better plastic surgeons for those procedures. And I did pay to license those logos from Statista. That's how they make their money for doing it. They don't tell you you're going to be on it. They don't ask you if you want to be on it. There's nothing about
There's no charge to be on it.
Yeah. Here's the list. Now, once you're on there, if you'd like to license their logo, which is totally smart and totally legit, because I have logos that people have had to license because I'm smart about getting my trademarks. That's really smart. And also, it doesn't taint the study because they wait to see what the outcome is, and then they offer that as
they
can't
have to
buy
make
on.
Money too. Yeah,
you can't buy on.
Right.
So it's a really good model. They've made it pretty simple, and you don't have to. So you can still be on their list. You just don't use their logo.
Yeah.
And you can report. I was on the Newsweek top thing. I was doing this. You just can't use their trademarked logo
because it's their logo.
So it's still news. You could still put out a press release that says I was in Newsweek. You're reporting on news, which is fine. But if you want to show that logo, which is because I think so many people believe in it, that the methodology of that study, it's great. For me to become a preferred provider on a very powerful website would require a 45-minute interaction on a phone call and then probably to pay some fee of some kind. So I'm never going to be a preferred provider for the biggest information site. That's the point. So when you see these lists of who the top people are, well, did they pay to be on that list? Did they not pay to be on that list? Is it really about who's best? That's the thing that was sort of disturbing.
The general public is never going to know.
No.
Because it's too hard to go down that rabbit hole and figure out like why you're on any given site. So the best thing again is to go back and just continue to research the doctors that you're interested in. Talk to former patients if you know any, look at their website, look at their social media, do a this is the terminology I'm using. I have a son applying to colleges. They're looking at him as a holistic applicant. Do a holistic approach to your surgeon. Yes. Like, what do they do? What are their specialties? What have they put out there? What do their befores and afters look like? So don't just go based on, one rating site or one review or what have you. Like, do a holistic review of your surgeon.
Yeah, and that's really the key. I mean, we've done podcasts on how to pick a plastic surgeon, what is the importance of board certification, all that sort of thing. But these, recommending sites, like this is going to be a business. I mean, if WebMD is getting into it from a cash standpoint, then it's like, all right, well, I guess I'll never be a preferred provider.
Can I make a quick segue on this? Because now you just reminded me of something that kind of stuck in my claw the other day. So insurance
It's a bee in your bonnet.
A bee in my bonnet. Insurance companies are also doing this, and they are highlighting some of their, because they also call them providers, some of their providers as preferred providers, and they kind of put them at the top of the list. Well, you know what gets a provider to the top of this list? Not spending a lot of the insurance company's money. So if the insurance company can look at how much money a provider has spent, and if they think that they are a cost affirmative doctor, then they will bump them up to the list of their preferred providers. So they are incentivizing the doctors to not spend too much of the insurance company's money. So what does that mean for the patient? Maybe less tests, less care, less visits. I mean, think about it. And it's crazy. But then the other thing too is that, because I have a dermatologist colleague that was telling me about this, the most complex dermatologic problems that go to these really niche dermatologists and require specialized tests, because other dermatologists have no idea what this is.
Right.
So they send them to these sort of higher level dermatologists who do all these serologic testing and antibody testing and special studies. They've now been bumped down to the bottom of the preferred provider pile because they spend so much money doing such intense focused diagnoses. So all that to say, don't take everything at face value.
No.
Unfortunately, that's sort of where we're at these days.
Yeah, the news is not true. Like there's like all this stuff that you just kind of have to realize, like everything with a very, very large grain of salt, and verify the information yourself, because it's made up. A lot of it is just flat out made up. I mean, it is wacko that in this day and age that nobody is interested in the integrity of the information that they put out. It's just not that important to them.
It's not that important.
It's just not that important.
Yeah. And because I've done this a few times, whenever there's like certain doctors or names in the social media world, and I'm like, who is that person? Who is that woman? Who is that guy? And I'll go and I'll try and do like a little bit like, oh, where'd they train, or who are they? If you can't find anything on the internet about what kind of doctor this person is, if there's nothing that says, residency in this or board certified in this specialty, and it just gives you like maybe a medical school name and then no further information on that doctor, huge red flag, because that usually means that they are claiming to be a kind of doctor that they are not, and they've scrubbed the internet of their actual training. If you go and look your eye up, you'll see either on our websites or through like Health Grades or through the California Medical, you'll see every single residency and board certification that we have. It's not hard to find. It's right there in your face. So if you've gone and you've looked up a doctor and you can't really find out anything about what they actually are or are supposed to be doing with their training, red flag.
Yeah, I mean, and look at all the fake profiles of like J. Calvert MDs that there are. I mean, there are easily 500 fake profiles.
It's because you keep taking money from poor women.
It's like, I mean, I don't know how to explain this to people. I get probably once or twice a week some sort of DM from somebody who goes, oh, I did a reverse image search and I found out I was chatting with somebody who's not you. And just to let you know, this is the profile of the person that took, $7,000
tons of money from these poor women. Yeah.
I mean, then it's crazy. And it's just, I don't know how to explain to people, like, don't send money to people you've never met. Like, how is that? It's really rough. I mean, but these guys are really good.
They're really good. And it's only going to get slicker with all of the, what is the AI thing for the face? Deep fakes.
Oh, yeah.
Deep fakes where they can just really manipulate your face and make it look like you're actually talking in a video.
Oh, yeah, they do video chats.
It's going to be,
Yeah, I mean, there's one woman that like she was like, just, no, I spoke to you on video chat. Like, I talked to you about your son that was killed in the war. I was like, my son wasn't killed in the war. I've not been in a war myself. I'm not in Syria defending. Like, I mean, these stories that they use, and they use my photos, and it's just crazy. So, it's a large digression from where I was with, watch out for marketing.
Watch out for WebMD.
Watch out for WebMD. WebMD's fine. But the point is, again, you got to really verify the information, because it doesn't, it's so erratic and uncontrolled. And there's like, these people don't have any interest in you, the patient, getting a good operation. They could give a crap about that. What they care is that they spend 45 minutes on a phone call with me, and I write them a $10,000 check every month to have my name listed on their website.
Of course.
Because that's easy to do.
Yeah.
Couple of keystrokes. It's up on the web. They put it up there. It's there for life. People may click on it. They may not. They don't care. What they care is that the doctor is sending 10 grand every month
sales
to be listed. That's what they care about. They don't care that you, the patient, found me and you got a great rhinoplasty. That's nice for you. That's nice. Good for you. They just want their money. That's what they're in the business of. Their business is information for money, period. And that's hard for people to, but aren't they like a government? No.
Nope.
They're not. They're not. There's no regulation for any of this stuff. People make up whatever they want and say whatever they want. And you just have to decide as the patient, like, are you getting information that has any integrity to it? Is it real? Is it where, that's, again, go back to our How to Pick Your Plastic Surgeon podcast. Those are sort of our best
tips,
best practices,
yes,
on how to find a surgeon for you, not a provider.
No, we are not. We are surgeons.
We are. I'm sorry.
Our license say physician and surgeon.
And it is interesting, by the way, that they've distinguished physician and surgeons.
It is interesting. Although I recently heard this story that, so you can be a nurse practitioner and get a doctorate in nurse practitioning, which is usually like an online course for a couple years where you learn about how to teach and
prescribe
not even like clinical stuff. It's all about like sort of the behind the scenes of teaching and maybe some research and stuff like that. But once you get your 2-year online doctorate, you can be called doctor. And so some of these nurse practitioners are upset because in the field of medicine, if you present yourself falsely as a doctor, that's illegal and you can be fined for it.
Right.
So there was one nurse practitioner who had a doctorate and was calling herself Dr. So-and-so, and she got fined for misrepresenting herself as a doctor, even though she technically has a doctorate.
Right.
And so they're suing the state of California now to be allowed to call themselves doctors in a medical setting. But it's confusing for patients. I get it. If you're in a university setting and you are Dr. So-and-so and you were teaching a course on anthropology, no one assumes that you're a medical doctor.
No.
They know that you got a doctorate in anthropology.
Correct.
But if you are a patient just trying to get medical care and someone introduces themselves to you as a doctor,
you think that they went
you're
to medical
going to
school.
assume that they are a doctor in the colloquial way that we all think of medical doctors. So there's got to be a way around it, not to discredit any of the training they've done, but you have to distinguish it for patients. I am a doctor of nursing so-and-so.
Right.
Or on your coat, your name, and like Psy D or nursing or whatever. But like, you just have to be very clear with the patients, because you're not, when you call yourself a doctor, that's just for you. You're not, like, it's not for the patient. You're not clarifying anything for them. You're just confusing them. So why are you calling yourself a doctor? I don't know. That's my own little digression.
Maybe it makes you feel good.
It does. It makes me feel good.
Yeah, it does. I did some solid work to get there. So did you.
I know.
All right. Well, anyway, that's our
It was like our
podcast
hodgepodge.
on like
It's like a potpourri
what's going on.
of Saturday morning rants.
This was not a rant-free zone.
It was not. Sorry.
Nope, not at
Sorry.
all. Yeah, but we'll be back with more information on actual plastic surgery.
On actual things that we do as surgeons.
I think it's. I do not want to downplay the importance of this podcast. It's really important. I think the more transparency And the more authenticity and proper representation of what is so is best for patients so that they can make good decisions, because this stuff is life altering. And I've got a whole revision rhinoplasty practice that says that, you need to choose wisely.
Yes.
And with that, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.